What is EHDI? The Region 3 Early Hearing Detection Intervention Team's goal is to educate, consistently identify and evaluate, and provide services. The recommendations in this presentation are based on best practices and listed on our resource slide. Over 90% of babies born in hospitals have hearing screening prior to discharge. Early intervention for hearing loss is important because it is a neural emergency. Early effective intervention equals more impact and less educational needs later on. Better opportunity for optimal outcomes. Universal newborn hearing screening was mandated in 1998. Initial guidelines allowed children to be identified by a 1-3-6 plan. Screened by 1 month, those that do not pass the screening should have a comprehensive audiological evaluation by no later than 3 months of age, and should be fit with hearing technology and enrolled in early intervention program by no later than 6 months of age. States that have successfully achieved the 1-3-6 model are now striving for 1-2-3. A hearing loss can develop at any point in one's life. Children can also pass a hearing screening with a mild or slight hearing loss that is educationally significant. We can expect 6 in 1,000 children to have educationally significant hearing loss upon entering kindergarten. Every child referred to Help Me Grow or to the early childhood team needs their hearing screened. The team needs an objective measure of hearing when a special education evaluation is completed. This includes an autoacoustics emissions test, an auditory brainstem response evaluation, or a hearing evaluation from a licensed audiologist. It's particularly important that a child with Down syndrome, cleft palate, or any other craniofacial abnormalities has their hearing evaluated because they are at higher risk for hearing loss. Most common tool used to screen hearing in young children is an OAE. The OAE is not a test of hearing, rather it helps us assess some important sensory cells in the inner ear. It then helps us identify children who need further hearing evaluation. As a reminder, children can pass an OAE screening with a mild or slight hearing loss, which is considered educationally significant. Who in your district is performing the OAE screenings?
This flowchart helps screeners understand the process of screening and rescreening and when to consult with the educational audiologist. This flowchart is linked on the resource page at the end of this presentation. If you have any questions about the ECSE OAE screening flowchart, please contact your Region 3 EHDI representative. If hearing loss is suspected or identified, this is a neural emergency. Hearing is a first-order event for spoken language, reading, and learning, which is all based on early development of the auditory centers of the brain. In language development, research indicates that children will need at least 10 hours of hearing technology usage per day to stay on track with their same-aged peers. This image shows a child's listening bubble with and without hearing technology. For optimal listening, you should be facing the child and within 3 feet. What do we mean when we say mild hearing loss versus educationally significant hearing loss? Mild hearing loss or deficit is a term that is used in the medical clinic and refers to an adult with hearing loss with fully developed spoken language. In children who are still learning language and reading, the term mild is inappropriate, as so much language may be missed. A child with hearing loss is aware of spoken language in the environment, but will not be able to fill in the gaps or know when they have missed a portion of the spoken information.
Hearing loss is a low-incidence disability, which can include vision loss. That's why we have specialists to serve the unique needs that arise from the disability. Each team member brings expertise to serve the unique needs of the child. What are the similarities between a clinical audiologist and an educational audiologist? Both types of audiologists have the same level of education and have the child's best interest in mind. Although your student may see the clinical audiologist on an annual basis, the educational audiologist has the flexibility to see them more frequently as needs arise. The educational audiologist has specialized knowledge and can observe the listening environment and make recommendations and changes to optimize the child's access to spoken language in complex listening environments. Deaf, hard of hearing teachers support the technology in the learning environment and provide troubleshooting, and when and why to bring the educational audiologist to the educational team. Ideally, children with hearing loss will be evaluated and followed by both a clinical audiologist and an educational audiologist because of their advanced education and extensive knowledge of evaluations. This is what you can expect from an educational audiologist. The reasons for this presentation is to clarify the roles and responsibilities of the educational audiologist and the teacher for the deaf and hard of hearing.
It depends on the district or cooperative, and the duties can vary as far as the responsibilities of the educational audiologist and the teacher for the deaf hard of hearing. Teachers for the deaf hard of hearing support the team and provide in services on hearing technology and support families on how to use the technology. The teacher for the deaf hard of hearing and the educational audiologist are different professionals with distinct roles. There is a lot of collaboration, but we have different training and focus. These are examples of roles, but roles vary between districts based on their resources and availability. Talk with your local team to see what roles look like in your district. This document has been published through the Educational Audiology Association, and it's included on our resource page. This is an extension of the roles on the previous slide, and you can review them if you're interested and/or ask your team if you have any questions. The audiologist is the only professional licensed to evaluate children's hearing and fit the hearing technology on a child, including the remote microphone hearing assistive technology system. We look forward to collaborating with you. Thank you for listening. On the next two slides, there are resources and regional contacts in your area.